Hello, this is Tokyo Anesthesiology Clinic. This is the third episode of our special edition series. Today, we will discuss an important topic. Chronic pain cannot always be explained only as physical pain. Behind the pain, there may be suffering related to something that was lost. There may also be suffering caused by relationships with other people. These kinds of suffering may be hidden beneath the surface. Today, we will organize these two types of suffering using the terms spiritual pain and social pain. Then we will discuss how they may be related to ketamine therapy. We will ask our clinic director, Dr. Tori. This video provides general medical information for the public. It does not provide individual diagnosis or treatment advice. If you have symptoms, please seek an evaluation at a medical facility. In an emergency, please use emergency medical services. In this episode, we will use an AI avatar of the clinic director, synthetic voice, and synthetic video. The content has been supervised by the clinic director.
Hello, I am Dr. Tori, the clinic director. First, I will start with the conclusion. I do not want to say that ketamine is a medication for spiritual pain itself, and I do not want to say that ketamine is a medication for social pain itself. It is not that simple. However, when suffering becomes connected with pain, insomnia, anxiety, and depressive symptoms, and when that state becomes stuck, ketamine may have the potential to create some room for change. That is what I am paying attention to. Today, I will talk about a way of looking at suffering that forms the basis for this idea.
Doctor, why do we talk this much about suffering on a channel about ketamine?
The reason is simple. Symptoms are not made up of the body alone. In chronic pain, depression, and anxiety, there may be a deeper suffering behind the symptoms that appear on the surface. Where does it hurt? How severe is the suffering on a scale? Of course, those questions are important, but sometimes they are not enough. What has the person lost? What are they afraid of? Which relationships are painful? What is shaking their sense of existence? If we do not look at these questions, treatment may have difficulty moving forward.
Let me organize this once. When people hear the word pain, many may think of physical pain, such as injury, inflammation, or nerve pain. But in actual medical care, pain is sometimes understood not only through the body, but also through psychology, society, and even a person's sense of meaning or loss. Within that broader view, today we're focusing on spiritual pain and social pain. Is that right?
Yes. First, the important point is this. Spiritual pain is not simply about religion. In general, it may be easier to understand it as suffering related to meaning, role, connection, and loss. On the other hand, social pain is suffering that arises within relationships with other people. Rejection, isolation, comparison, evaluation, pressure to conform. These experiences can sometimes be felt almost like pain. From here, I will share my own clinical perspective. I see these two kinds of suffering as suffering that exists in the unconscious realm, and I see them as two sides of the same coin. People suffer when they lose connection, but people also suffer within relationships with others. These two forms of suffering can be deeply involved in chronic pain, depression, and anxiety. That is how I see it.
First, please tell us about spiritual pain.
In my view, spiritual pain is a deep suffering related to the loss of connection. Human beings have survived over a long period through bonds with other people. Connection with other people is not just a matter of feeling, it has also been a foundation for survival. So, when a person loses someone important, loses a role, feels they can no longer return to who they used to be, feels that the future is closing off, or feels that death cannot be avoided, they are not simply sad. They may carry a suffering that shakes their very existence. I understand that kind of suffering as spiritual pain. This can be seen very clearly in patients at the end of life in palliative care, but it is not only about the end of life. In chronic pain and depression, it may appear in forms of, I can no longer return to who I used to be. I cannot see any meaning ahead. I no longer have a place where I belong.
Then what about social pain?
Social pain is suffering that occurs within relationships with other people. Human beings are supported by others, but at the same time, they are evaluated, they are compared, they are restricted, they are excluded, and sometimes they may feel as if they are being punished. Family, school, workplace, organizations, society. As relationships increase, not only support, but also pressure can increase. In modern society, I believe this aspect is very strong. Having many connections does not always make life easier. Pressure to conform, shame, roles, comparison, structural disadvantage. Even when there is no obvious punishment, people can be deeply wounded within relationships. And this suffering doesn't end as simple as stress from dealing with people. Social pain that occurs within an individual and suffering that appears as distortion in society may have the same structure. That is how I think about it. In this video, we will only introduce the entrance to this topic. I will add more detailed explanations in the companion note.
I see. The suffering of losing connection and the suffering of being hurt within connection. These are like the front and back of the same thing.
Exactly. And in both cases, the person may not be able to put it into words from the beginning. What appears on the surface may be symptoms such as, it hurts, I cannot sleep, my mood is low, I do not want to meet people, I feel anxious all the time. But behind those symptoms, there may be fear of losing something or suffering related to being involved with others. If we overlook that, we may end up chasing only the symptoms, and treatment can easily go in circles.
So this is not only related to chronic pain, but also to mental health symptoms like depression.
Yes, that is how I see it. For example, meaning has disappeared. I feel connected to no one. Just being around people wears me down. I do not feel alive. When people are in states like these, calling it simply a low mood may not be enough. Sometimes viewing it as spiritual pain or social pain can bring us closer to the core of the symptoms. Of course, this is not a replacement for textbook diagnostic names. These words are not meant to change the diagnosis. They are a clinical way of understanding the person's suffering. Please do not misunderstand this point.
So, is this where ketamine becomes relevant?
Yes, but I will say this carefully. Ketamine is not a medication for spiritual pain itself, and it is not a medication for social pain itself. What I am looking at is a state where suffering has become tightly connected with pain, insomnia, anxiety, and depressive symptoms, and has become stuck. Using the language from the previous episode, this relates to neuroplasticity and salience. A certain memory, a certain loss, a certain relationship, a certain bodily sensation, these may become fixed as something that is always important, always dangerous, and impossible to escape from. When that fixation loosens a little, the way pain is perceived or the way relationships are perceived may change. That is where I see the potential of ketamine. However, this does not happen in the same way for everyone. Careful judgment about indication and safety management are essential, and this is not something that can be completed with medication alone. Sleep, daily rhythm, environmental adjustment, psychological support, reviewing interpersonal relationships, everything that is needed should move forward together.
So, for you, doctor, ketamine is not simply something to lower symptom scores. Rather, it is one possible tool that may introduce change into the structure of suffering that is binding the person.
That expression is close. What I truly want to see is not only the numbers of symptoms, I want to see what kind of suffering the person is bound by. What are they afraid of losing? Which relationships are painful? That is the point. Ketamine is one tool within that larger picture. The main focus is always the overall understanding of suffering.
We don't want viewers to self-diagnose and think, I have spiritual pain, so this is the answer, or I have social pain, so this is the treatment. Are there any safe take-home points?
Self-diagnosis is not necessary. However, during a consultation, please try to communicate more broadly. Do not only say where it hurts or how severe it is. For example, what have you lost that feels painful? Which relationships feel difficult? In what situations do symptoms get worse? Do you feel isolated? Has your sense of meaning or hope become weaker? These kinds of points are important. Please try to share these things with your doctor. Including this information may change the way treatment is understood. And please do not increase, decrease, or stop medication based on your own judgment. The stronger the suffering is, the more important it is not to carry it alone. That is very important.
Finally, please summarize today's topic.
Today's points are threefold. First, chronic pain cannot always be explained only as physical pain. Second, people suffer when they lose connection, and people also suffer within relationships with others. Third, when that suffering becomes tightly connected with pain, anxiety, and depressive symptoms, treatment may have difficulty moving forward. I consider spiritual pain and social pain to be important perspectives for understanding that suffering, and I view ketamine therapy as one possible way that this fixed state may loosen slightly. However, ketamine should not become the goal itself. Appropriate indication and safety management are essential. More than anything, we must first understand the whole picture of the person's suffering. That is today's conclusion.
Thank you. The general overview discussed in today's video, as well as the more detailed parts of the clinic director's own clinical perspective, will be summarized in the companion note. Please see the description box for details. This channel provides general information for the public. We cannot answer individual medical consultations. Thank you for watching today.
Thank you.